you just will be recorded. Thanks very much. So this information session is intended to provide content and context for what's happening in the primary care world within the North Zone. Really, our goal today is give everybody an opportunity who's signed on chance to seek clarity and to learn what we're doing in the North Zone, some of the new developments and new structures that we have in place or will have in place. The presenters will share each of their topic areas, and then we will pause for questions and answers. This is your opportunity to really ask those questions to seek clarity. So if you do have a question, just a reminder that if you want to raise your hand by clicking on the participant button, we will ask for you to speak one at a time. Or if you're more comfortable, you can certainly chat into the chat box as well. Just to let you know, on the participant screen, there are other buttons as well. You'll see yes and no. So as we go through our presentation today, I will be asking questions along the way, and you can certainly say yes or no. Also identify to us if we're going too slow or too fast. So certainly use those buttons that are on the participant screen. So the subjects we're covering today with our less than 60 minutes is really the background and context of why we're here, where we're going, some of the new developments, the what and the why, and then our call to action and invitation to you. So I'm just going to proceed on. So here's our presenters for today. Samantha Semergrad, she's the Executive Director for the Grand Prairie and Bighorn Primary Care Networks. Lisa Kemp is the Manager for Primary Care in Alberta Health Services. And myself, I'm Ping Mason Lai, the Project Manager for the North Zone, responsible for the zone service planning. I don't see Lisa on, so we will be trying to cover her components if she doesn't sign on. I know she was traveling en route. So hopefully she's able to sign on where she's from. And as well, want to welcome our moderator, Lori Apostle, who's going to be helping manage the chat box. So feel free to make sure you chat in as we will be monitoring the chat box. So this session is brought to you on behalf of the North Zone Primary Care Network Committee. And our committee is a partnership between the 11 primary care networks in the North, Alberta Health Services, Alberta Medical Association, and Alberta Health, our funder. Our sponsors are Dr. Helen and Greg Cummings, and really want to thank them for their ongoing support and their endorsement of these sessions. We couldn't have done any of this work without their blessing and their sponsorship. So a little background and context for everybody on the phone who might not know what's happening or has happened in the North Zone and what's happening in primary care generally. So just a little bit of background and context about zone primary care governance. On this slide, you should see our organizational structure for the provincial primary care committee that reports directly up to the health minister. And underneath the provincial primary care committee are these zone PCN committees, and every zone has a PCN committee, and you'll see the 5 there for the 5 zones. And input into the zone committee actually comes from all the primary care networks within the zone. So as I mentioned, the North Zone has 11 primary care networks, and they actually provide input into the zone committee. The zone committee is comprised of physician leads from each of those PCNs and some executive directors, representation from Alberta Health Services. In the North Zone, we have senior operating officers from different portfolios. Of course, our sponsors, the dyads, Greg and Helen. And then there's a support team as well that has representation from Alberta Health, AMA, Alberta Health Services. And really, that's the structure of the PCN committee. Every zone has a different makeup of their committee. So the North Zone doesn't have physician leads from all 11 primary care networks. We actually have less with some groupings of geographies where physicians are representing 2 or 3 PCNs, and they bring back information to that geographical area. And as well, EDs, we don't have EDs at all 11 EDs, or sorry, there's no 11 EDs in the North Zone, but the executive directors in the North Zone do not all sit at PCN governance as well. We just have 2. Where in contrast, I'll give you an example where the Empton Zone actually has all 9 of their physician leads and all 9 of their executive directors sitting at their PCN committee. So a little different structure depending on the zone and how they wanted to form governance. And just want to give you that little bit of a background. And these zone committees were set up based on Alberta Health and their ministerial order to really lead the development and implementation of zone improvements and primary care transformation. And you can see on the right side of the graphic, there are task groups that report up to the provincial primary care committee as well. And you'll see that there's related to continuity and access, chronic disease. There's one specifically on zone service planning, and there's transitions as well there, and evaluation. One of the key deliverables for the zone committee is a zone service plan. So this is fairly new for each of the zones to work in partnership with primary care networks and Alberta Health Services and community to develop a zone-wide service plan, identifying the needs and the gaps in the zone and coming up with implementation strategies and action plans to implement. As you can see by this graphic, this is the timeline that Alberta Health had put in place for the zones to deliver a zone service plan. The North Zone started this work quite early when the formation of the zone committee was in place. And in terms of timelines, we met our objective of delivering the zone service plan for the North in September. We received our official approval of that zone service plan in February of 2020. But you can see the timelines there. So the zone service plan, what is it? It really is a high-level strategy document identifying priority areas for focus in primary care for the North Zone. And we have to align to objectives set by Alberta Health. These objectives at a high level are alignment, integration, and shared services across the zone. The North Zone, as I mentioned, submitted their plan, and it is a 3-year service plan. So from 2020 to 2023, we are responsible for implementation. And there is a requirement by health that we actually submit yearly amendments or updates. Our service plan covers these priority areas as directed by the zone PCN committee on where we needed to focus: chronic disease and comorbid conditions, addiction and mental health, frail complex seniors, maternal child, and the populations that we really want to focus on: Indigenous health and vulnerable and unattached. So this is direction from the zone committee on where areas that we need to focus. In terms of the details of what's in the zone service plan, certainly we're willing to share a copy of the final zone plan. But in terms of implementation for year 1, and we're taking our zone service plan implementation baby steps at a time, really focusing just on year 1. And these are the priority areas: transitions of care, looking at maybe doing some pilots where appropriate, with the implementation of the provincial home to hospital to home guideline, and also really addressing the unattached and vulnerable population in the North Zone. There's a high volume of unattached patients in the North due to various reasons, but this is something that the zone would like to work on. Navigation support is another item that has come up in several of our gaps needs assessment. And really that navigation support is finding out where to send people, where the services are, unknowns in terms of community resources, those kind of things. And then finally, integration, alignment, and capacity building between all the partners, specifically in addiction and mental health, really increasing the capacity within primary care, building awareness across all the partnerships about what the patient's medical home is, and then trying to get patients attached to patient's medical home, And then leveraging the provincial projects that are already in place in the North Zone. And as an example, there are lots of chronic disease pathways that are being developed that we certainly want to just integrate into practice and into operations. So really quickly, that was a high level, rapid summary of zone service planning. We know it was very quick, but we weren't planning the session to cover all about service planning. We really wanted to get into the next couple topics, and that's the intention for the presentation. But I will pause here to see if there's any questions. Great, so just hit yes if we're okay to move on. Click on your little buttons there. Excellent, thank you. So I'm just going to pass it over to our next presenter. And before I do that, I just want to say our plan, really the next few presenters are going to just identify what our plans are to achieve implementation of the zone service plan. Because our zone service plan, it really is a high level strategy document with some priorities. We don't really have the how we're going to accomplish this and the specific activities. And the North Zone is such a large geographical expanse. So how are we going to accomplish implementation and what needs to be in place to be successful given the partnerships and the expectations? So I'll pass it over to Lisa.
Hi, can you hear me?
Yes, go ahead, Lisa.
Oh, good, thank you. So this slide here is a visual depiction of where the service planning work began and where we're headed. So on the left side, talks about some of the structures that are supporting the work that Ping likely spoke about earlier. And the middle section there with the three circles, addiction mental health working group, chronic comorbid, and transitions working group, were three groups that we started out with subject matter experts to set up take it in smaller bites and set up the service plan. But what we want to do for implementation is move towards an integrated, more innovative co-design. And so if you look on the right, the three bubbles in the middle there are what we call the integrated operations team. And that's Ping, myself, and Sam, who are all on the call today. And our strategy is that we want to help support setting up 6 local health neighborhood cohorts. Because of the diversity and mass of the North, we want to take it down into smaller bites, and we don't claim that these are small communities by any stretch of the imagination, but it is a way to break it down a little bit more and get more of a local lens.
So what is the primary integrated operations team? So as Lisa mentioned, we are a triad leadership, and that's between primary care, Alberta Health Service, and our project manager, Ping. So we see ourselves as the backbone support needed to coordinate, communicate, and facilitate service planning. And so our objectives are to facilitate and support the implementation of service planning, co-design and planning of future service plans, and we're really a forum to aid in development of action groups and the health neighborhoods. And so what are we not? So we are definitely not an authority group or an approval group. All the authority and approvals come from the North Zone PCN committee. So we're not a formal entity, but we are a way to support and organize the work. And of course, there's no additional funding or resources for this work.
So in other words, all hands on deck. So what will a local health neighborhood coalition achieve? It's really our solution to how to implement activities that are on the ground. And I want to just bring up that this is not really a new concept for the North Zone. There are pockets of this type of work happening all over the place where communities will integrate Alberta Health Services, primary care networks, community resources, and improve, for instance, youth mental health. And so it's a model that's worked, and there's just different variations of that. And this is a good foundation for us to start. So just a little bit of background. In December 2019 and January of 2020, this year, we conducted several engagement sessions. There was a total of 5 that were geographically cohorted. And that was to discuss the service planning and how implementation might look. And it was very apparent that there was a lot of local passion and engagement and willingness for people to develop relationships and co-design services that meet the population needs. And so this is where this idea came from as a vehicle to move this work forward. So there is going to be, so there's guidance provided by the integrated ops team, that's ourselves. The intent is to choose local co-chairs in a collaborative leadership model and continue to have support by by the integrated ops team. Looking for diverse membership, patients, families, community resources, AHS continuum care and primary care organizations, and in order to have those local conversations and implement the plan.
So this vision statement is also the statement for the primary care transformation. It's also something we've included as part of our draft terms of reference. So the primary health care system supports improving the health of all Albertans by ensuring that individuals, their families, and caregivers are at the center of team-based and integrated health and social services at a community level. And so the objectives of the Local Health Neighbourhood Coalition: meet the goals and improvements in primary care in the zone service plan, act as a mechanism of change and action, implementation and action planning of zone priority activities, and a collaborative model that can be sustained to support integration and service planning.
So what is it going to look like? Well, led by local co-chairs and leaders, as I mentioned before, and the stakeholders will be dynamic, diverse, and the group will be nimble and action-oriented. It's thought that different groups there might be offshoot groups that want to tackle smaller bites or different things that are relative to the local area. And so that nimble membership is very important. We want local voice having the ability to make local decisions. And this here is just an enlarged version of that third part of that earlier visual that shows you how the local health neighborhood coalitions will be divided up. Now, the first one that we're probably that we're working towards is LHN1, which is Grand Prairie, Peace Region, Saddle Hills, and surrounding communities. And that decision was made based on several different components, varying levels of involvement in the work so far, and different transitions in leadership. That's not to say that that other groups that are ready to get working on, start doing other work that might align really well with this model. We'd love to support that and don't want to dampen that kind of engagement for sure. And of course, setting up the local health neighborhood coalitions is not going to be something that you can flip a switch and do overnight. And we've all had quite a year with several distractions, but we're targeting to start with a pilot of the first LHNC in Grand Prairie region, and hoping to implement at least one more before the end of 2021. It's again nimble, it's new. It's something that we want to gauge and engage our partners in helping us to improve. The draft terms of reference is really just a scaffolding that we want to co-design and co-build on from there, and make sure that it fits the needs of the local area.
So some of the key messages to take away is this is a different approach to achieve the implementation of the Zone Primary Care Service Plan. There's going to be growing pains, but our idea is to be creative and resourceful. And of course, we're always going to encounter barriers and challenges as we go through this work. We know that change is difficult, but we also know that change can't occur without relationships. Care is a continuum, and solid working relationships and partnerships can support and facilitate an integrated model of care that benefits everybody. And so we believe the health neighborhoods may be the way forward to meet the vision and goals. So which are shifting the focus from hospitals or acute to community-based care closer to home, planning healthcare with people in communities, improving continuity of care and system navigation, empowering people to be active partners, and integrate healthcare with the other public services to form a system that links Albertans with agencies that address the social determinants of health. So I'm going to tell you a little bit of a story scenario to give you an idea of how a local health neighborhood might work. So remember, it's not just PCNs and Alberta Health Services that form the health neighborhood. There's community services, municipalities, patients, citizens, that's just to name a few. So we all come together and we discover we all have a similar problem. So we've heard accounts from people in our organizations or within our community that finding information on programs or services is hard. There's so much out there and so many resources. It's hard to know where exactly to send people when they ask questions. So although we're focused on healthcare for service planning, we know that issues we have are not limited to just healthcare. So think about a person who needs mental health support. So maybe they have mild depression. At the same time, they've lost their job, financial stress, maybe their spouse has diabetes, their family can't seem to cope. So I think in healthcare, that's a scenario we see quite often. So they see their family physician who tries to refer them for programs and services. So most family physicians don't have access to all that information to provide on what is available and by who. So does AHS provide all the applicable programs? Does their PCN have something? So what is available for community supports? Searching out what is available and most appropriate can become overwhelming as the issue is not solely mental health. So from a person-centered care perspective, we not only need to address the clinical needs, but the social needs as well. So there's so much out there, but not knowing what, where, how to access, when, and who provides is something we think is a problem that can be approached with all of the work when we look at putting together, centralizing for the North Zone into maybe a single resource tool. So this could be a tool that can potentially support navigation and create clarity, but the real outcome is the collaborative working relationship in doing this differently. So this would be potentially one resource with all of those different small bits of information and services that might be available. So perhaps in the future, beyond the first year service plan priorities, this type of work and product or tool can help us look at duplication in programs and services and putting very limited dollars in healthcare and community social services to different and creative plans.
So today's for you to have the background information and know where we've been and know where we're going. And it's really a call out for participation. We're looking for co-chairs for the first local health neighborhood coalition. We are absolutely looking for specific criteria, attributes, and there'll be an invitation at the end of this for you to participate. So what are we looking for? Well, we have some common characteristics that we're looking for. We want people who are local to the area and knowledgeable about the area, that have a dedicated interest in healthcare services and system improvements. People that understand this is about the greater good for the population and to put their own interests and activities on the side for the sake of that work, and have the ability to make decisions at a local level. Our co-chair, of course, we're looking for someone with strong communication skills and an ability to foster and build relationships, because we know that's the very foundation of all of this. And for members, we're looking for people who are dedicated to attend, committed to the meetings, action-oriented, and want to contribute to the implementation. And I think we hear a lot that we are great at planning and we are great at all that background work. We get great ideas, and then we fall short on that implementation. We also hear there's, oh, that's top down, and what they're asking us to do isn't operational. And so it's our hope that this is a solution to that, where we can combine the best minds, the diversity of minds and efforts, and move this work forward. So we are calling out to you and calling out to you to spread the word. So those are our next steps. The 5 engagement sessions we did previously are a good start. Because we met a lot of people that were very keen, very engaged. We want to circle back to those people that participated, that are familiar with the work, and ask them to also share who might not have attended, who might be interested. And not just for the LHN1, but other areas, whoever is, you know, passionate, ready, wants to just maybe get started socializing this idea. The integrated operations team would like to help you with meet and greets and build on existing relationships and build new ones as well. And so our timelines that we're talking about are again to start with the co-chairs and developing a group and getting started on the work and hoping to get that rolling in the fall.
So we have a
That's
couple questions from the chat. So let's start with those. And if anybody else has questions, raise your hand or just chat in. So the very first question comes from Glenn. He's referring to checks and balances in terms of the business plan. And if we move ahead, are we noticing any results, or is this a living document that can change as circumstances dictate? So Lisa, Samantha, you want to start, or you want me to chime in?
So I would say, Glenn, that this is definitely a living document. So I think as we kind of go, we're going to be able to, I don't think we can adapt the whole document, but it's definitely living, and there's definitely changes that can be made.
Yeah, I think the whole idea is just to have an idea and a vision of where you're going, but really work with those local areas and understand what's going to work for those groupings. Everybody has different strengths and gaps, and can learn with, from, and about one another to gauge the work. So we do intend for it to be nimble. So
in reference to the zone service plan, that is a document that is submitted and approved, but it doesn't mean the objectives or priorities do not change from year to year. If there's something locally identified that might require some adaptation of that zone service plan. So as I mentioned, we do have to submit a new amendment this year, starting in November. We have to start that work again for Alberta Health's requirement. And so if there's new things that come to the top in terms of service priorities, of course, that has to go through the zone committee itself for final approval, but it does get amended. So there will be constant updates as required. So hopefully that answers your questions. The next question here is, why not co-develop the 6 groups at the beginning phase, representatives from each center on a central committee driving the formation of the various bodies? Great question. Samantha, Lisa?
And so I'm not sure if I understand the question. Like,
why don't we start with all 6?
Oh,
that's what I'm interpreting. Is that correct, Alex?
I think we did talk about this. Do we just get them all up and running, ready to rock? And I think we recognize that we're a small group, the integrated ops team, but also maybe starting with one, getting that one up first to see what kind of learnings we can take. So I think we did talk about it. I think the groups or the health neighborhoods will develop quicker than likely we've put in our timelines, because I hope that once the word spreads, people will be more engaged and want to get going.
So I just want to add that certainly representatives from those neighborhoods, whatever ones we can start and stand up sooner, will be part of the integrated ops team. So there will be that conduit of and flow of information and integration. So the integrated ops team is not intended just to be the triad leadership. It is actually is more than the triad leadership. It actually will contain have a linkage back to these local health neighbors with the co-chair hopefully sitting with us and being that liaison, bring forth information. I think having us start slowly is a strategy because of where everybody's at in the North Zone. There's lots of changes happening in primary care, in the development of where PCNs are at, and in their business plan cycle, and where they're staffed in terms of their leadership. There's constant changes currently. So I think we're being a little bit cautious and just starting one and making sure that we actually are successful with the one. It doesn't mean that we can't stand up others if there's interests, for sure. And we're not fixed in our plan that we would only start one for this year and not start any others besides that second one. So certainly we're nimble in terms of that plan, but we want to make sure the very first one is really solidly set up and we learn from it. So hopefully that answers your question, Alex.
Yeah, and I think if there's a health neighborhood or a PCN that really is raring to kind of get going, we're not going to stop that. We're going to support them. But yeah, I think we just set it out like that, knowing that there's a number of changes going on with different PCNs in the zone. And so also just using that one to get going to take some learnings.
My comment was basically regarding the initial startup. So where everyone in a committee has to work with the same framework at the basic level, as opposed to the area specific. So there's opportunity to combine resources when developing the very basic ground rules and then move up from that point on.
Yeah, and that's not a bad idea for sure, I think. I think where we were coming from is that the local flavor, making that local piece. Certainly we have that foundational start formation piece with the draft terms of reference, which is 80% there, but we really want each of the local neighborhoods to develop and approve their own terms of reference, because there might be some nuances there depending on membership and stuff like that. So, but certainly let us take that away and have further conversation, but it's a great point, Alex. Yeah, definitely want to consider that for sure. Thanks for that. Any other questions? Just checking the participant screen here. So based on the information we've provided, is there any interest in being part of a local health neighborhood? If you want to just click on your participant button, yes or no. We have a few yeses, great. So for those that didn't respond, was it because we didn't give you enough information? What might be missing? If you don't mind just chatting in quickly. And also, just as you're doing that, just want to mention that we're not just looking for a PCN or AHS. We're looking at community agencies as well. Anybody in the community, patients, citizen, community agency groups, because we're dealing with population health and social determinants. It's not just, we need to look at the holistic approach here.
Yeah, I think that's an important point, Ping, to make, that we don't just want PCNs and Alberta Health Services around the table. We want a varied, as many different people from different places as possible to make it diverse.
And we're also looking for more operationally minded as well, because this is about implementation, as Lisa mentioned. We have lots of great planning, high level strategy, but it's the getting to the how and actually implementing. So a comment about the time commitment. So just so you're aware, the terms of reference are fleshed out in terms of kind of the building structure, but the details have to be actually defined by the co-chairs and the membership of that committee for final approval. So certainly in the beginning with any group forming, you probably meet a little bit more frequently, and your terms of reference would dictate the frequency of your meetings and the commitments, but the time commitment is really based on what activity or actions would be coming out of the coalition. Certainly we have high level priorities that we have to deliver for the North Zone in terms of the zone service plan. But it doesn't mean that all your time would be committed to that specific activity if that wasn't your interest. But there also might be offshoot activities of that local coalition that might be more pressing or more of interest, and there might be offshoot groups that might work on it. So these local coalitions are really meant to be action oriented, and so the time and commitments would be dependent on the activity and individuals involved. So I couldn't tell you exactly what that looked like right now based on not having these in place yet, but it is supposed to be driven from the ground up.
And I just wanted to add to that I'm starting to see an opportunity for an actual time saver. I think that people start worrying about all the competing priorities, Connect Care's coming, other things aren't slowing down. But in the last week alone, I've heard of 2 or 3 brand new initiatives where the intent for each of those groups is to say, oh, we want to do engagement, we want diverse stakeholders, we want really, diverse participation. And in those cases, those 3 things could actually align into this one model. And so I think that that's what is one of the hopes of achieving this, is that you can't be several places at once, but if there's work happening with 5 priorities in your area, you can tackle it as a group and leverage each other's strengths. So I think that the intent is that this would be more efficient in the long run.
Yeah, that's our hope. Any other questions? Great, thanks, Sue. Yeah, absolutely. As Lisa mentioned, that the model isn't new to the North Zone, and certainly familiar with what's the great work coming out of McLeod River for sure. And due to recent changes in McLeod River and their leadership, we actually had originally planned to kind of start there as well, but we did speak to physician leaders there, and timing wasn't great. So, but certainly want to leverage what Terra's and McLeod River are doing.
And Bonnieville's done some similar work as well with these integrated teams, and has seen some successes. So we have a lot of things to learn from and grow from, for sure. And again, we don't want to damper any of that enthusiasm or change it. There's some stuff that's working well that eventually we're hoping it all kind of blends into one, but certainly doesn't mean this is replacing something that's been established and is working well.
Just Tara, I'm not sure if you want to just come off mute and add anything else to that.
Can you hear me?
Yeah, go ahead.
Just you know me, I always like to add something. No, just glad to see something like this is happening, and I think it's good that it's going to be the entire zone, and then definitely learning from each other what is working, and then just what isn't working, and then focusing on what is working and building off of that.
Great, thanks, Tara. Appreciate it. And we'll be touching base with you to learn more of what the work you're doing. So.
And I was just going to say, Ping, Tara has been working very hard with the team at McLeod River about looking at alternatives to 211, because it's not working like we had hoped it would. And they're doing some work with the Help Seeker Act which is fantastic. And I think that could be a really great learning that we'll want to share, because it's making it so much easier for people to find the resources that they need, and it's very intuitive to use. So
Great, thanks, Sue. Yeah, I think the Health Seeker Act, we've heard it a few times in different conversations, and something certainly we want to tap into and take a look at for the navigation piece that we want to implement in the North Zone across the board. So yeah, definitely we'll be reaching out. So another question, again from Glenn, is this initiative affected by the healthcare review by the current government?
So it's not. I am not aware of any to this work that we're doing.
I would echo that. I've been through the EY report backwards and forwards, and I don't see any significant impact that is going to have on this.
And I think the whole point to everything, and I think great question, because that's lurking, right? Nobody knows how that's going to go, regardless of what happens, and we're in it together. And so whoever we are at the table is what we will have to work with. We have each other. So I think that's where we're hoping that this is the foundation for moving forward in a new way of working. So anybody willing to, I call it the tuck and roll, be nimble and go along the journey.
Yeah, it's Lori here. I just wanted to just jump in, and I think with this piece of work, we have to not think about it so much as a project or a initiative per se, but how we're going to be restructuring our businesses moving forward to deliver care. So this isn't just a let's jump in and tackle this and move on to the next project. This is how the government expects us to transition to how we're going to deliver care in the future, if that makes sense.
Great, thanks, Lori. I was just about to chime in there. Really, the key outcome we're hoping with these coalitions is that collaborative working relationship. How do we work with each other in a really effective and seamless, smooth transition piece? We come from different organizations, and we all have our own policies, procedures, our own cultures, but really for primary care in the North Zone, we have to remove those artificial barriers or the barriers that are there and really get to true collaboration and meaningful impact for patient care. And so this is something that we hope will help get us there. So we learn to work together really well. And it doesn't matter which organization we're from. So hopefully, Glenn, that helps, answers your question there. I think the only comment I would make, though, is that the impact I see actually from the review will be in terms of relationships and the people that you have relationships with. They might not be in the same place, and that might be this switch for us, especially when you form really great relationships and start working with each other. Those people might not be in place depending on these reviews, right? So I think that's a reality that is in place. So we just have to make sure we forge ongoing relationships, continue to foster new relationships, those kind of things. So I see that Jessie's put her hand up. Thank you, Jessie. I'm not sure you're still on, but really appreciate the fact that you're putting your hand up to say you're interested, and we're certainly going to reach out and touch base with you. Any other questions? I'm just looking at the time here. And we promised that everybody would be off right on the hour or earlier if there is any other questions. So did we give you enough information about these local health neighborhoods? Okay, so Alex, what resources are available to help groups build relationships, contact info? Certainly, Alex, when we start, we really want to be highly transparent. Again, it is relationships, it's helping build. So the integrated ops team will kind of play that secretariat support in the beginning, so that backbone to help get these things up and running and really getting our co-chairs. Hopefully we can get those first co-chairs set up to really lead the change and drive the change, and to really share resources where applicable. So whatever we have in place right now is not much, but there's a lot of information that we can tap into from other organizations in terms of building this coalition, but resources coming from the PCNs and AHS that are already in place, so more in kind kind of things versus new dollars or new bodies. But this triad leadership is dedicated because this is something that's really important for the North Zone to test out and move forward. Lisa or Samantha, anything to add there?
No, I think you touched on everything. I mean, our plan is to for sure facilitate meet and greets, attend some of the meetings, make sure we can help and support the group in any way. And I think it's really important as we look at recruiting, or you're telling your colleagues or friends outside of your organization about these health neighborhoods, that we do really want action-oriented people. We want people that are motivated to change and who want to be there, right? Because that's going to help us get moving and build relationships and start setting the pace.
And for me, I think what's exciting is that we're pioneering a new way of doing things. As Lori Apostle had said earlier, it's not just a project or a thing, a flavor of the month. It's a vehicle to move forward with for everything in a new model. And I kind of like that uncharted territory. I like knowing we're in it together. And I think one of the things I have noticed every time we get groups together, they always say, oh, I thought I knew about your services, but I didn't. Or I knew you did that, but I didn't know you did this. And that might change how we approach this, knowing that you're there. And so that truth of what's happening is in that collective truth, and hearing from the patient and the family voice and the voices of everybody who touch patients in one way or another, and look at that whole continuum of the social determinants of health. So it makes sense, and it seems like it's common sense, but we haven't commonly done work that way before. So I'm hoping that other people sense that enthusiasm in me and come along for the journey.
I'm seeing some comments come across. Thank you, everybody. Appreciate so really, we still have 8 minutes. If there's any other questions, feel free. But if you do need to leave early, I just want to thank everybody for spending the afternoon with us for the last 45 minutes or so. We do actually have a formal invitation ready to roll, and we will send that out to all the participants on this call. Just so you're aware, we ran this session on Tuesday, and there's requests to come up with a one-pager about local health neighborhood. We also have the terms of reference that we can share out. There was also a request for a copy of the zone service plan. So certainly any of the documents that we've produced are not secret. We're more than willing to share and really get people engaged in this work and to move this forward. So a heads up for all the participants, you will get some attachments in your inbox in the next week or so. And then this session is recorded, so we're trying to find a place to place the recording. So if you have individuals that are interested in learning more about this and want to listen to the recordings, certainly once we identify where we're going to house it, we will send that communication back out to the individuals who participated today and from Tuesday as well. So you can redirect others and start to spread the word.
Ping, had you put our email for the integrated operations team?
Yeah, I'm just
up on there yet? Oh,
no,
okay,
perfect. Go
perfect.
to next one.
Thanks.
Yeah,
Awesome.
and then if you need to get a hold of us, so hopefully you've seen this email address already when you received the pre-material. So I'm just going to quickly, before you sign off, put up a poll here. Great, thank you. Appreciate that. So I'm glad it was helpful, but it should have came from this email address that you see on your screen right now. So if there's any information that you're seeking or have other questions that you thought of after the session, certainly feel free to email the address that you received the session information on, and it's primary care north zone at outlook.com. And that's monitored by the three of us. So we will definitely respond in a timely fashion. So before we sign off, one final question. So if you can just use your participant buttons, yes or no. Was this session helpful? Excellent. Thank you so much. And just one final comment. The other group actually asked for these to continue. So they wanted, if you weren't participating in the local health neighborhood, but wanted regular status updates. So the request was to have these type of sessions on a regular basis. So we're just in the planning stages of trying to put that into the schedule where we would deliver these kind of information sessions, maybe quarterly. We haven't quite decided, but to deliver these again, just to give you a status update on how the coalitions are doing, if there's more than one, and what they're working on, that kind of thing. So that was a great suggestion from our group on Tuesday. So we're most likely going to implement that as well. So Lisa, Samantha, any final comments?
No, we look forward to working with everybody, and we're super excited about this work, and happy Friday.
Absolutely. Ditto.
Thank you so much, everybody. Appreciate your time and look forward to working with everybody as well. Thank you.
Thanks.